We're here at the CROI 2016 in Boston. We're here with Aisuluu from Kyrgyzstan, and she is a scholarship recipient, and you are in a position to give us your first impression of the CROI, and I'll let you do that off the bat.
I'm really enjoying it, and you can know it for sure because this is the only conference to attend which I'm waking up at 5:30 to be on time for community educators meeting, and then go back to bed like not earlier than 11 a.m. or 11 p.m. So you can understand how
you feel it.
How interesting it for me, and I'm learning a lot, all these new developments related to microbicids, vaginal rings for women, and all the PrEP information which we lack back at home, and also this plenary session lectures like about transgender women today, or gene therapies that sounds so promising, is so exciting. Mm-hmm. So I'm learning a lot, but there are times when I feel really dummy because it's so scientific at the same time.
You got to wade through that. You got to brave it out. And once you start to understand some of it, then a little more of it. I think that's important for our audience to realize that you're a lay person coming to a conference that's extremely scientific, and you get there eventually. But you're at the first step, which is the first day.
And I think it was also really great that I have two brilliant mentors and also a lot of colleagues from EATG who are helping me to filter through the scientific part and really, getting the information that's the most important for the key populations and people living with HIV back in Central Asia.
So tell us about that population. Tell us about your experience back there, because this is a place that doesn't have a lot of empathy. The country doesn't have a lot of empathy for people living with AIDS.
Something to tell about Central Asia, I think, is stigma is so high, both towards people who live with HIV, but also towards key populations. And I think the ones who are really like the most stigmatized population are MSM, because of local traditions and cultures, like or maybe because also I was volunteering for a grassroots level organization working with MSM, and at a certain point I was providing services of voluntary HIV testing, using rapid tests and counseling, and sometimes we had to go to parties of small parties of 5 people because people were afraid to come to the office as then they could be associated with a community of MSM, or they didn't trust anyone else outside these 5 people they are partying together.
That's a good model.
So this shows the level of stigma among general population towards this key group, I think.
So how is healthcare delivered there? Is that a troublesome issue?
It's really different, I think, from the rest of the world. We have a heritage of Soviet health system when everything was so fractured. You have TB system in some place and HIV system completely not talking to TB system, and drug addiction services completely separate from both of these services. So for instance, if I am a woman who inject drugs and at a certain point I get pregnant and I need, and I learn that I'm HIV positive and I need to get RV treatment, in most of the cases I would end up traveling whole day just to get all the services. So getting OST at one spot, then traveling to another part of the city to get tuberculosis treatment, then seeing my gynecologist in another part of the city. So there are some interventions now to provide one-stop shop services for key populations, but they're kind of more on a pilot level. so you don't see it being available and accessible in all parts of Central Asia, like in all countries and in all places where these people live. And it makes, it becomes an extra barrier for some people to get quality services.
So the biggest challenges that you that you face are not really being able to get everything in one place. Do you think the government or the health department is trying to discourage people, or is it just the way they plan to see it as that they see that kind of health delivery?
I think, I really see that the stigma is growing, and unfortunately, sometimes health service providers are also part of general population. So I wouldn't say that there is no stigma among health service providers towards key population. Like, of course, there are certain service providers, like the staff of AIDS centers or people who are involved in opioid substitution treatment services. But it doesn't really mean that any other medical service provider, like general gynecologist at primary health care or someone else that key population members would want to get services from, wouldn't have the stigma and wouldn't be judgmental and would be really friendly. So it's really hard. I think it's, the things that put extra barrier for HIV treatment or seeking medical health services for key populations is really like complex. It's both stigma, lack of knowledge about new innovations in testing and treatment, a lot of centralized approach to testing, and requirement to show your ID in order to get confirmative HIV tests, and it's a whole bunch of things that make a lot of services for people living with HIV and key populations very high threshold, hardly accessible, and sometimes very unfriendly. So, and also something to mention, as we were part of Russian Federation for Russia for quite long, and a lot of governments in Central Asia, they still have this, tendency of leaning to Big Brother and trying to follow after them. So sometimes you see how this affects HIV services or HIV prevention interventions in the countries. Like, for instance, recently established moral departments in both Tajikistan and Kyrgyzstan who are basically witch hunting sex workers and LGBTI population, or the anti-gay propaganda laws that are being adopted in Kyrgyzstan, and Kazakhstan is also considering to do something similar. So this all, of course, affects both higher rates of stigma, higher rates of violence against key populations, and less willingness from key populations to seek for medical services.
Well, it seems like there's extraordinary challenges. What are the organizations that are kind of fighting activistly for this change, for a change from this stigma? I'm sure it isn't going to happen overnight, but but you'll incrementally at least try to move towards a more amenable society there.
There are really, I'm afraid I will just, offend someone if I just don't list them, and there are really a lot of NGOs working in this field. There are a lot of very dedicated government officials in all Central Asian countries. Unfortunately, not all of them are so dedicated. There are UN organizations who are providing really great support, and USAID providing technical support and some small grant opportunities for direct services. So there is really strong advocacy efforts happening at the same time to tackle the issues that I was just describing. So things are not that bad. We are trying to improve it, but sometimes it feels like you make 2 steps forward and then, or basically 1 step forward and 2 steps back.
Right.
And it feels really bad. And also the fact that, you know, a lot of advocates and a lot of HIV activists don't have good or strong language skills in English. So it also, you know, limits their ability to learn new things. For instance, I feel so privileged to be the only Central Asian at this conference, like the only Central Asian who won scholarship, but at the same time, it makes me feel really sad because that means there were so many others who are similarly brilliant, who are very talented, very dedicated, and the only reason they didn't apply for scholarship most probably was the language barrier.
I was going to say that it didn't for lack of an application, because I'm sure there were application, it was able to be applied for. But yeah, the language barrier would definitely be a problem, because the science is in English for the most part, yeah. So what are you're considered a third or developing world or actually a middle income country, right?
Yeah, I think we were just moved to a middle income country recently, but
that makes it bad for you.
Yeah.
Yeah, because then do the people there in that country have to pay for their own drugs?
No, luckily we still have Global Fund who provides most of the ARV drugs and most of the TB drugs for people who need it. But because of the stigma, you know, people get diagnosed really late, and when these estimations of how much or how many drugs we would need, I think the estimations were made based on official statistics rather than, you know, the real
because if
numbers.
it's stigmatized, the people are hiding out.
Yeah, so
they don't want to be identified. Yeah.
So you see the difference. That
Is it the evidence? Is the comment been made by organizations that the less the stigma, the more people are going to get at the treatment, the less people are going to be new infections are going to appear? I mean, it seems to make this cycle that's very important to get involved with.
I'm afraid, you know, the Central Asian countries don't yet have that much information related to treatment as prevention or
treatment as prevention.
Yeah, or prevention like PrEP programs. So it's really hard. Like we are still in a process of educating community members so that they get empowered and they start demanding for this kind of attitude from governmental officials. But we are at early stages of educating communities so that they can advocate better for the services they need.
Right. Well, we wish you very much luck. We hope that you'll do better, and we hope that you'll come back again. But you're the first person from Asia that we've seen and a long time. So this isn't just this year, that's other years as well. In my recollection, I may be wrong, but I hope you'll be coming back, and I hope you'll learn, and I hope you'll be able to be productive with what you've learned back in your country.
Thank you. I'll try my best.
Thank you very much.
Bye.